Welcome back to Wellness Wave Radio. Thanks for tuning in this morning to ride the wave with us. Each week our goal is to give you at least one suggestion that will make your life a little bit better. My name is Phil George. I'm a clinical biochemist, a certified personal trainer, and a health coach. Please remember that everything we discuss in the show is for informational purposes only and should not be taken as medical advice. So we have a real interesting show today, and a couple of things maybe a lot of people don't know, but as a biochemist, health coach, and just people I know in general, people are, a lot of times they'll ask me questions. They get something from their doctor and they just want a second opinion. I'm not a doctor, but I will give you at least my advice. And what a lot of people don't know is that 40% of all women at some point in their life are going to have a urinary tract infection. So this is a pretty common problem. So as a clinical biochemist, my job was basically I would do lab work. My undergrad's in biochemistry. Then a clinical biochemist is a biochemist that works in a lab or runs a lab, and we do all the lab tests. I consult with physicians in terms of pathology, and just means what what's causing the problem. And a lot of times I'll know what's wrong with the patient before the doctor does because I looked at it. So during my 20 plus years working at a Holden Hospital, and just let you know, all our shows are on YouTube. So anything you want to see is on there. We're also on Dreamvisions 7, which is an international show. In fact, that's the best place to find our shows. Everything is listed in order. All of these shows, radio show, TV shows, podcasts, YouTubes, everything is on Dreamvisions. So you can email me, philgeorge@charter.net. And we can, I'll send you a link to that site. And again, this is the health disclaimer if you want to see it. It basically just says, this is for informational purposes only. Everybody's different. So whatever information I give you, it may work for 99% of the population, but it may not work for you. So again, do your own research. I'll give you what, from my experience, what I think. But so 40% of all women are going to have a urinary tract infection at some point in their life. In the 20 plus years I worked in a lab, and I must have done tens of thousands you see that's when they would bring it to the lab to me. They would bring in a urine sample. So what happens with in terms of the urine sample? Let me just back up. So I had a girlfriend at one time, believe it or not. I actually had a girlfriend when I was better looking than I am now. So I had a girlfriend, and my girlfriend, she says, geez, I think I have a urinary tract infection. I said, okay. So she calls up her doctor, her primary care, and he says, yeah, it sounds like you have a urinary tract infection. Symptoms are you get burning when you urinate and things like that. So he says, I'm going to call in a prescription to the pharmacy. And I said to her, fire him. And I'll tell you why. This happened, actually, my girlfriend way back when, but this happened to me 2 days ago. Somebody called me and had a relative, same thing happened, and they called in a prescription. So here is the problem. Urinary tract infection can be caused by two basic things. One of them is urine, obviously, for bacteria. And the normal bacteria that causes the urinary tract infection, something called E. coli. Now, E. coli is what is in your stool, your feces. So what happens is the reason that women get urinary tract infections and men rarely get urinary tract infections is because the anatomy. A woman's anatomy is entirely different than a male's anatomy. So women are more predisposed to having a urinary tract infection. So I said to my girlfriend, I said to my other friend that had this relative that had a problem, I said, the problem is this, one problem is you don't know if it's a yeast infection and you don't know if it's a bacterial infection. So what happens, you have in your GI tract and basically all over your body, basically we're petri dishes for viruses and bacteria and yeast. We all have that, but normally they coexist. There's normally not a problem. Every once in a while, something will get out of whack. You're not supposed to have E. coli in your urinary tract. In fact, a lot of people don't know this, but actually your urine is sterile. So it's totally clean. So what happens is if you just throw a prescription at it and they have a yeast infection, it makes the yeast infection worse because bacteria actually kind of fight with the yeast to keep the yeast in balance. And the main problem with the yeast is, again, they're going out of control. So if it is a yeast infection and your physician orders just a general antibiotic, he's going to make the yeast infection worse. So then you're going to have to come back, and there's whole different types of drugs for yeast infections. So two are separate. The other big problem with even if it is a bacteria infection, there's different kinds of bacteria. So you guys have probably heard of it. They call antibiotic resistant. So what happens is, what you're doing is you give them an antibiotic that may kill bacteria A, but it doesn't kill bacteria B. So you could be taking this antibiotic for 6 weeks, and you still have the urinary tract infection because that particular antibiotic does not kill that particular bacteria. I'm going to get into kind of the lab stuff I used to do, give you a better idea. Actually, kind of like a real look at what I did as a clinical biochemist. So the first thing we do, you can actually get this at CVS. These are strips. So in fact, when I worked in the lab, a lot of times what would happen is a nurse would come down. Let's say she's Nancy Nurse. And she's a nurse. She knows she's probably got a urinary tract infection. So she would come down with me with a urine cup in her hand, and she'd say, "Geez, can you check this out for me?" No lab order, but we're in the hospital. We do favors for each other all the time. So I get that, and usually I can tell by looking at the urine. Urine's usually clear. Okay, if it's cloudy, you either get some kind of crystals in there, like maybe you got uric acid crystals, or you've got calcium oxalate crystals, or something is in there. But more than likely, it's urine. So it's clouding up. It's clouding up. So I can look at it. This sounds kind of gross, but I could actually smell it, and I could tell that's a urinary tract infection. I'm not even looking at it under a microscope. I could actually tell it's a urinary tract infection. Because what happens is, if you have bacteria in urine, you start breaking down the urine. You basically release something called ammonia. You can smell. You know what ammonia smells like. So I can tell by looking at it. But to be sure, what I would do is I would then do I would do my due diligence and go over it. So what's the next slide? So I'd run this. You can buy this at CVS. You can just stick it in there, and it tells you. It tells you if you've got ketones in there. It tells you if you've got sugar in there. It tells you you've got white blood cells in there. So that kind of gives you an initial way to look at it. Okay, what's the next one, Art? Okay, so what I do is I take the urine, and basically I put it on a slide, and I put it under a microscope. Now, if she does not have a urinary tract infection, I'm going to see this. I'm going to see these things floating around in there, and I'm going to know that's a bacterial infection. So I can tell her right then, look, you definitely have a bacterial infection. You definitely have a UTI. Okay, next one, Art. I'm also going to see, these are white cells. Okay, you see the lab tech at the corner there? I used to be a woman at one time, and now I transitioned over to a man. So that's me. No, I'm just kidding. So that's what I used to do. I would look at it under the microscope. You can see the little strip there. I have that in there. So I got double, triple confirmation. You're not supposed to have any white cells in your urine. You're not supposed to have any bacteria in your urine. So then what I have, I have that. Now, if that comes in and I see this, remember what the bacteria look like. Again, I'm trained to know this. These are yeast cells. These are what yeast cells look like. So I don't have to test for this. I know this. This is called morphology. So bacteria, morphology is a fancy name for they have certain shapes to them. So I can tell that's a yeast infection. So if I tell Nancy Nurse, look at Nancy, you got a yeast infection. You don't have a bacterial infection. There's a whole different drug for that. So that's why it's important. And what I mentioned, if the doctor just says, I'm just going to throw any antibiotic on it at all, Again, if it's a yeast infection, it makes it worse. Plus, if it's not the right antibiotic, you have to see exactly what kills that particular bacteria. So if you have a friend, again, 40% of women are going to have a urinary tract infection at some point in their life. So what you want to tell the doctor, tell them that you want the urine cultured, which means I'm going to take, I'll show you, there you go. These are what's called Petri dishes, and this is what I do. So I would have 6 Petri dishes like this, and what I do is I get the urine, and I have something I stick into the urine, and I swish it all over these Petri dishes. In fact, the one on the bottom left and the one on the bottom right, that's actually what they call sheep's blood agar. Agar just means whatever type of gel they have in there. If you can see those white things around on the both on the left and the right, that's called lipolysis, which means what it's doing is it's breaking up. I'm sorry, that's incorrect. It's hemolysis. It's breaking up the blood cells. Lipolysis is breaking up fat, so that's not lipolysis. So hemolysis, basically, you're breaking it up. So that gives me a good indication right off the bat what type of bacteria it is. So once I swish the bacteria on there, I put it in an incubator, and I take it out in 24, 48 hours. And what I showed you in that previous slide, that's what it's going to look like to me. I'm looking at it. And again, it sounds gross, but I can sniff it, and I can tell by the smell, basically, because did this for 20 years. I can tell pretty much between the smell of it, how it looks on there, the agar it grows on. Different types of bacteria grow on different types of agar. Some grow on sheep's blood, some grow on something called, I think it's been a long time, I think it was called EMB. It's a different type of agar. And some bacteria will grow on some agars and they won't grow on other agars. So we have a really good idea at this point exactly what, in fact, I still worked at the lab. I would have brought a Petri dish in with me, not a clean one, and I would have showed you exactly what we do. So that's what happens again with the Petri dish. So we don't just guess and throw an antibiotic at it, because we don't know if it's bacteria, we don't know if it's yeast, we don't know what kind of bacteria it is. Just to throw something at it is not a good idea. You guys have probably heard of antibiotic-resistant bacteria now. One of the big complaints they had with physicians is you come in with a sniffling nose, they were throwing an antibiotic at you. It's not a bacteria, it's a virus. An antibiotic does nothing at all to a virus. In fact, it makes it worse because it's going to mess up your gut bacteria. It's called dysbiosis. In other words, the antibiotic not only kills the bacteria, it also kills the bacteria in your gut, the good bacteria. I mean, you need this. It's really, really important. So you're going to be real careful with antibiotics, because you're not only killing. Sometimes you need antibiotics have saved. Probably the greatest invention of modern medicine is antibiotics. And in fact, interesting story, a little science lesson here. So what happened is, I think it was Louis Pasteur. I'm not sure, I may have been. What happened is they had some bread out on a counter, and it became moldy. If you leave bread or muffins out, it goes green, right? If you see green, that means you got mold on there. So what happens is the mold also has bacteria in there. And they found out by accident, and a lot of things in science, I had a course in college called the History of Science. A lot of stuff is kind of interesting. And what happened is they found out, and they had some bacteria sitting around somewhere, and they found out when they put that moldy bread on the bacteria, it killed the bacteria. And that's how they came out with antibiotics, penicillin. Penicillin was the first one. So so if you go on Who Wants to Be a Millionaire, share some of the money with me, or you can call a friend, you can call me, and I can tell you that. So what happens is, in addition to growing the bacteria, so once I swish that Petri dish, that little round dish, with the urine sample, and I'll put these little round discs on there, and they're soaked in different types of antibiotics. One of them is penicillin, amoxicillin, all the different types of antibiotics. And I'll put them all over the dish. Then, like you see over there, once I take it out of the incubator, I can see which one of those discs that it's been soaked in a very specific antibiotic kills it, because there'll be a big round circle around it. It means it killed all the bacteria. Other discs, there'll be nothing around it, which means that bacteria is resistant. It doesn't do anything to it. So then I find out that your particular urinary tract infection, I did this for everything. I did this for throat cultures. Do you have strep? I did it. I've done it for synovial fluid. If you got some type of meningitis, I've done it for that. Ear infections, skin infections, same procedure. It's on petri dishes, and we put things around to see what kills it. So it's not just for urine. This is the same procedure I did for for all different types of bacterial infections. And a lot of times it's not bacteria. It could be yeast. It could be a virus. If it's a virus, nothing's going to show up. We really don't have a way. I didn't when I was in the lab. They may have one now. There are certain tests. Basically, it's called serology. Like a good example is mononucleosis. So mononucleosis is caused by something called the Epstein-Barr virus. And anybody out there, when I was a kid, they used to call it the kissing disease. I had mono, and so what happens is with mono, what we did is we had it's called serology. We would take the blood sample, put it in something, mix it around, and if it changed a certain color, then I know it's Epstein-Barr. So I could also tell by looking at a blood slide if it's Epstein-Barr, because Epstein-Barr, get a little going a little bit down a rabbit hole here, but Epstein-Barr it elicits a very specific response to your blood. You have white cells, and one of them is called lymphocytes. Lymphocytes, again, when I'm looking at a slide, I'll see a lot of lymphocytes if you have a virus infection. If you have a bacterial infection, I'll have something called a polymorphonucleoside, different bacteria. But what was interesting about Epstein-Barr has something called an atypical lymphocyte. It's really a pretty cell. It's a big, I should have brought a picture of it. It's a big right blue cell. You can't miss it. Bingo, that person's got mononucleosis. So we double check it with the serology. So when I go see the doctor, I say, okay, doc, this person's got mononucleosis, case closed. Then rest, water, blah 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 with that. So what's the next slide, Art? Okay, so we talked before if you have a yeast infection. No, this is a bacterial infection, E. coli. So the most common type of bacterial infection is E. coli. This is kind of a joke. It doesn't actually show that. It would make things a lot easier if I just looked at the petri dish and realized it was E. coli. It doesn't work that. But I'll be able to look at that and see the pattern and know it's E. coli. Okay, next slide. This is Candida albicans. This is the most common yeast infection. So again, we put that on a different petri dish with different agar. Remember, agar is that gel. And this, I'll look at that. I'll say, bingo, we have a yeast infection. Different drug for that than is for the other one. Okay. And the other thing we look at sometimes is what happens if I'm looking under the microscope and they come in and let's say you got pain. You get pain in your kidneys. I'm going to see this. These are calcium oxalate. Like this is what caused kidney stones. You're not supposed to have any kind of stones at all in there. So again, I've done this for more than 20 years. I just know by looking at it. In order to become a clinical biochemist, I had to be certified. So what would happen is I have to go through basically clinical tests. Well, I have to pass a written exam first of all. Kind of like in medical school, you got to pass a written exam. Then I have to pass a clinical exam. So they would, the pathologist, I was certified through the Society of Clinical Pathologists, and they would say, okay, what kind of crystal is this? I look at it, I say calcium oxalate. What kind of crystal is this? Uric acid crystals. Okay, see how nasty that looks? So uric acid is what causes gout. You know how painful gout is when you got it in your big toe? Those are like little needles that actually get stuck in there. So if I see that slide, I'm saying to the pathologist, that's uric acid. Also, synovial fluid. Synovial fluid is a fluid like between your joints, your wrist, here, feet, everything else. You can have uric acid crystals anywhere. You could have it in your knee, theoretically. So what a physician would do is they would take a syringe, they would take the synovial fluid out of there, they'd send it over to me at the lab, I'd put it under, take it out of the syringe, put it under the microscope. Doc, he's got uric acid crystals. So this confirms the diagnosis. Okay, what's the next one? Okay, so again, this is what I did. These are lab techs. This is called my lab bench. So what would happen is, again, I would go over. I'd have a whole bunch of. I must have done tens of thousands of urine. So I've probably seen thousands and thousands of different crystals, bacteria, and yeast and everything else. So let's go back to that slide. There's a reason for this. So what would happen is, part of my job, every few months, they would send medical students into the lab, basically, and we would teach them on lab procedures. So I would do what I just told you about. I'd show them uric acid crystals. This is what this looks like. This is what that looks like. So they have an idea. Let's stay on that slide for a while. There's a method to this madness. So imagine that's me in the middle with the long hair. Okay, use your imagination. Then I would have two medical students standing next to me, and I would have a whole bunch of urine samples, and then I would stick the urine stick in there, and I say, well, they have this, this, and this, and I would explain that to them. Then you go from there, then you go to something else. So I'm training, and we would play this trick on medical students every year. This is pretty funny. Okay, what's the next one, Art? Next slide. No, next one. Oh, anyway, okay, back up, Art, I'm sorry, my fault. So citric acid, like citric from, orange juice, right? Now, citric acid crystals, what happens is, what we did with the medical students, we would take orange juice, okay, and we would have regular water, and we'd put about half orange juice and half water. Now, you're never going to see citric acid crystals in urine. It's never going to happen. So this is never going to happen. You're never going to see this. But you can see that's really a freaky looking thing. That's what citric acid crystals look like under a microscope. So what happens is, I've already shown these medical students, I've shown them uric acid crystals, all kinds of crystals that you can see inside of there. And they've never seen this before. So they're gonna say, that's weird. What the heck is that? Next slide, Art. So what I would do, that's me, imagine that's me, and that's the urine sample. And I would say, well, remember, I got them around me, but look, they think this is urine. What I would do with them at the end is I would say, well, the only way you can tell if it's actually citric acid crystals is you have to drink it. And I would drink the urine. They'd freak out. They thought I was drinking urine. Obviously, I was not drinking urine. I was drinking the half orange juice. But we let them know. But it was a good trick. I don't know if they told the other med students afterwards, watch out for this idiot. He's going to try to trick you. So that's something we did. So again, you could learn an awful lot from different urine samples. If you've got diabetes and you're in something called a ketoacidosis, which is really, really bad, you're not supposed to have a large amount of ketones in your urine. I remember the stick I showed you. Put it in there. So with the stick, one part is ketones, one part is glucose. So you're not supposed to have glucose inside your urine. The other thing that stick tells you is what happens is your kidneys functioning correctly. Because if you're having all kinds of protein, you're not supposed to have protein in your urine. That stick I showed you, I should have brought one with me. That stick has all these little dots on it, and it tells you what's happening. In fact, if you ever wonder if you have a urinary tract infection, I can give you a good hint here. Just first of all, email philgeorge@charted.net. I can send you. You can get them off of Amazon, or you can get them at CVS. But you want a very specific type of strip. So if you suspect, I had in fact clients, usually elderly clients, and I would go out and do consult with them sometimes, and I'd work with the nurses, the home health care nurses and stuff like that. And what I would do is I would always bring the sticks with me, and I would say, to the nurse, can you get me a urine sample? They get me a urine sample, and I would be able to, first of all, I'd look at the urine sample. I didn't have a microscope with me, but I would just stick it in there, and I could see what's going on. If I could see if they have a bacterial infection, because it's going to show me there's bacteria in there. I don't even have to look at a microscope. So we knew ahead of time that there's a problem. If I stuck it in there and saw no bacteria, there's also one of those little strips on there. It also shows you if you have white blood cells in there. Okay, but again, it could be a yeast infection, or it could be a bacterial infection. If I don't see any incidence of bacteria on that strip, then I know basically that it's probably a yeast infection. In all the 20 plus years I was in the lab, I may have seen 1 or 2 men in terms of bacterial infections. It just about never happens. Again, the anatomy of a woman is entirely different than a man. The only time a man normally has a bacterial infection if he has some type of an autoimmune disease, if his immunity is way down, if he had like HIV or some other kind of immunosuppressant drug or something like that. Because what happens with the male, again, a different anatomy, so you just about never see that in a male. If a male has an infection, it's not good. The other reason why women want to know if they have a bacterial infection is because what happens is you can develop something called cystitis. Cystitis is kind of a generalized infection all over a woman. The other problem is it can go up into the kidneys. You can come up with kidney damage. You don't want to be having bacteria in your kidney. Right now, with a urinary tract infection with a woman, it's going to stay pretty much in the bladder. Okay, it's not going to go anywhere. But if you don't take care of it, what will happen? You develop cystitis. Cystitis gets a kind of a systemic infection where it goes up into the kidneys, and you can do kidney damage. So urinary tract infection is not something you want to take lightly. You want to take care of it. But again, I want to emphasize over and over again, you've got to know what it is, what kind of bacteria it is. You don't want to just throw an antibiotic at it. You want to know, is it actually a yeast infection, or is it a bacterial infection? Treat it entirely differently. What I like to say as a biochemist, I want to know the root cause of the problem. I just don't want to throw a drug at it. I want to know root cause. What's causing the problem? Unfortunately, I love doctors. I've had doctors on my show. Some of my best friends are doctors, but these guys are really busy. They get 15 minutes to spend with you, and they get a zillion patients. They get paperwork to do. They get this, they get that. If you call them up, again, nothing bad about doctors, but they just may, the odds are it's a urinary tract infection. It's going to play the odds. So you have to be the CEO of your own health, and you have to be a little bit more assertive and say, look, I talked to this biochemist guy, and he said, that it may be a yeast and maybe bacteria, and I want to know exactly what kind of bacteria it is. What do you think, doc? If he, I'm pretty sure he'll go along with it. Sometimes you have to kind of be a little bit more assertive, and no one cares more about your health than you do. Again, and this is what we did. We'd be able to isolate exactly what it is. So you want to know what's going on with you. You just don't want to guess at it and just throw something at it. Okay, any more slides up here, Art? 2. No more slides. Okay, so only got 2 minutes left. So that's the takeaway. What you want basically is you want to know what it is, and you want to know what you need to treat it. It's even the same with with a strep throat. You could have the other thing interesting with a strep throat when I was in the lab. Well, we could actually, a good way to tell without even seeing a doctor if it's strep throat. If you look down the person's mouth with a little bit of tongue suppressed, if you see little white spots in the back, that's almost always a strep infection. Streps are dangerous, and we would put that on the petri dish too, and it would show us it's a strep infection. You can also have what's called the staph infection, and that's a different bacteria, different things. Most staph infections are basically on the skin. You'll see it on the skin. You guys have probably heard of MRSA, which people get at the gym. They call it the flesh-eating bacteria. It actually eats through your skin, so you got to be really careful. You got to be really careful about that. Fungal infections, athlete's foot, same thing. There's things for that. So even though you can have an infection, it may be from entirely different things. So if you want a particular subject covered on here, I run across this stuff all the time. People ask me questions. Whatever I think is the most beneficial. Again, one suggestion to make your life a little bit better. So we'll be back next week. If you want something specifically covered, email me, philgeorge@charter.net, and I'll answer any questions for you. And thanks for tuning in, guys, and we'll be back next week. One of the most common questions I'm asked as a biochemist and health coach is, what are the best supplements to take? Choosing supplements is a tricky business. Many companies have poor quality control and questionable ingredients. In the past, I had to send clients to several different websites. I am now able to offer one-stop shopping for all the quality brands I recommend with no shipping cost and a lower price in most cases. Just email me, philgeorge@charter.net, for a free consult.